by a mix of significant challenges and some initiatives that borders along the human angle of public health. And that is why we bring to you what public health is and how we can collaborate with other stakeholders to ensure that the public health of Nigerians and Nigeria as a country stands as a whole and nothing is affecting it negatively. Today on the program we have two gentlemen, medical experts on the field, who will be talking to us on public health. Which way forward? We have Dr. Kayode Ahmed, who is a consultant. He is a consultant, public health physician, and epidemiology. You're welcome to the program, Dr. Ahmed.
Thank you.
And the second guest in the house this moment is Dr. Adewale Adesanya. He is a chairman, Association of Public Health of Nigeria, the Ogun State chapter. You're welcome, Dr. Adewale.
Yeah, good morning.
And then I will not be doing the program alone. My colleague is here, Simi Atabaru. Good morning.
Good morning. Thank you so much for joining us today on the program. Like my colleague said, we have experts in the field, and of course they would be doing justice to today's topic. Maybe I should start with Dr. Ahmed. Thank you so much for joining us. Maybe we should start by trying to get the picture of what the public health is right now in Nigeria, to be able to see the progress being made by this administration and your expectations as an expert as well.
It's okay. Thank you so much. Good morning, Nigerians. Public health is a very big specialization, because in public health we have epidemiology and investigation of infectious diseases. We have occupational health. We have social and policy formulation and all that. So public health is very significant, and of course it's about the health of all the people within the country and the nation. So what we have between Sunday this week and Friday this week, we are playing host to all the public health physicians in the country. They are meeting in Ogun State, and under the umbrella of Association of Public Health Physicians of Nigeria. I am the LOC secretary, okay. And by my side, Dr. Adesanya is the state chairman of the association. So it's a way of bringing all the experts within the public health landscape to Abeokuta in order to decide and find a way forward towards improving the public health situation of the country.
How bad is our situation right now?
It's as bad as you can think. It's as bad as you can think. You know, the low-hanging fruit that you and I know is the Japa syndrome. Then we have issues of outbreaks. You know, there is a cholera outbreak, there's Lassa fever outbreak. These are some of the things that, if proper policy is on ground, there is no need for us to be having outbreak every other year. While we should learn when there is one and put in place, you know, policies and programs that will prevent that. These are some of the things that we are deliberating in order to ensure that there is an improvement in the health of the community and the nation at large. Thank you.
Okay, Dr. Adesanya, let's look at Adesanya. Sorry for that. Let's look at how we have been faring in the public health sector. Yes, there are challenges. Are we saying we have not made any progress at all in the public health? Let's know what the goodies are before we start tackling the challenges one after the other.
Yeah, thank you very much. As my colleague just talked about, public health has to do with the totality of health care, everything that has to do with health promotion, disease prevention, treatment of ailments, and rehabilitation. So it's holistic care. And a lot has to be put in place for us to be able to render ideal and appropriate public health services to the public. And it's quite unfortunate that in Nigeria we don't pay premium to it. And the truth of the matter is that if public health practice is well implemented, we have very little to do in other sectors of healthcare. In public health, we see our people has been healthy, our clients, we deal with them. We don't wait for patients. We don't wait for somebody to fall ill to come to us. We see you when you are healthy, we help you to promote your health, and we also put measures in place to prevent diseases in such a way that you have no reason to visit the hospital. Let me give you an example. Whereas a surgeon waits at the door of the theater for somebody to come with breast cancer to operate the person, we get to you when you don't have the cancer and give you ideas, ways of living, and promote your health so that you don't fall ill. And this is an essential part of our healthcare that has been largely neglected, and a lot of enough premium has not been paid on it, and that is the basic reason why we kept on having a lot of payments spending on each and every day. And at the end of the day, of course, if you don't prevent very well, then you are going to spend a lot in trying to treat and to cure. So in Nigeria, as of today, we have gone through a lot of phases of transition. Of course, in the olden days, in the dark ages, when we don't even know anything about health, up to the situation, up to the time when we had Dr. Isaac Oluwole on board, who brought in this idea of health promotion and disease prevention, that is in the 1920s, and up to the level of where we started taking over the care of our health. We have had a lot of people who have done a lot in the field of public health. Professor Olukoye Kuti in the area of basic health services in the 1970s. And then when the primary health care came on board, and Professor Olukoye Kuti were lucky that he came back again as minister. And that period he paid a lot of premium on the public health practice. And if we have continued with that trend, by now we would have been there. But unfortunately, along the way, we lost it to an extent that we have various succeeding governments not showing much interest in health promotion and disease prevention, even including early diagnosis and treatment, which has to do with screening for ailments. For instance, I can remember there was a time where government will make a very fine budget on immunization, and of course, when you immunize, you are protecting the individual against specific disease. You're also improving the herd immunity of the community. But nowadays, most people don't really show much interest in it. If all our children had BCG, you'll find nobody being admitted for tuberculosis. That's the truth of the matter. If all our children sleep under insecticide-treated net, then the prevalence of malaria will go down drastically. We have much less to spend on malaria. That's the truth of the matter. But the point is, our literacy level and economy has actually affected us, that we are not even showing much interest in our health. You find out now that even if you give a treated net, a treated net to somebody, the person will take it to market and go and sell. Yes, we have a situation in which somebody will get a very fine bush meat and will take it to market, sell, and come back home without having something good to eat. It's basically because of the economic situation. Yes. This is a situation in which even those people who are our health experts in the field of public health are not even prepared to remain within the country again. The reason is simple. The foreign currency is an interest of every individual in the country now. And in a situation in which you make your money, and by the time you change it to foreign currency, you know it's nothing, then almost everybody wants to run after the foreign currency. So there are a lot of factors coming together. So human resources for it has been largely depleted. Political interest in public health has largely gone down. Even we ourselves, our own interest in public health has really gone down to an extent that most individuals prefer to fall ill and now start running around to look for money to care for themselves. So this is the situation.
Okay, some said, or maybe I should say that, it's in the public that post-COVID brought the health conversation, of Nigerians. For instance, the public health conversation a little bit more heightened, sort of, especially because of government spendings and of course the need for us to, more like we did not really have the infrastructure to take care of our people before COVID, and COVID opened the eyes of everybody to it, and of course government to be precise, and there've been a lot of spending thereafter, and we're expecting that that should have resulted in better services and of course better infrastructure, which of course we have in different parts of the state. Is it better now?
The simple truth is that in our country, emergency preparedness is very poor. Not only in health, but worse in the health sector. Not only health, but worse in the health sector. Our level of preparedness was very poor, and of course, public health physicians are usually the one that will face the heat when it comes. I'm happy you talked about COVID-19. We also had the Ebola virus disease, yes, before then. And in fact, almost every time we have cholera outbreak, we have a lot of all these cases. We are supposed to have measures in place to be able to handle emergencies when they come on board, especially these outbreaks. But unfortunately, the level at which we prepare for all these things are usually very poor. When COVID-19 came, of course, we had no choice than to start running around. I was in charge of the local government where the first case was reported. Ogun State had Abeokuta local government as one of the local governments that was epicenter in the country. I think there were about 18 or so at that time, and I happened to be the one to manage that area. To God be the glory, government had no choice then than to rise to it, and we were able to curtail to a very large extent. And we also had individuals who came on board to assist. But one basic truth there was that when cases happen like that, of course, responsive governments will definitely come on board. Ogun State government did a lot at that period of time. But what I usually advise is that you don't wait for armed robber to get your house before you start looking for burglary. It doesn't make any sense. So you get yourself fully prepared for any eventuality, and that was that is what I'm talking about in the area of public health. Most people don't value that; they don't reason about it. I continue to advise our political office holders that emergency preparedness is very important. All aspects of public health practice must be deeply looked into. Now, as we are talking now, when the situation happened and God on our side, we were able to curtail it, I'm not sure that the preparedness continues up till now.
Okay, Dr. Ahmed, let's talk about the reforms. Since government, especially the federal government, is the major stakeholder of health sector, do you think the government's reforms is helping the public health system? Do we need to rejig it? Do we need something new? Do we need to discard some of the reforms and look at how it can help us in this 21st century? Dr. Ahmed.
Okay, thank you. Let's give it to the government. I think the government of the present day, they are doing the best they could, especially this administration. Couple of months now, we have some new policies which has been introduced, although the implementation has not been very comprehensive as it is. Especially, I want to mention the issues of maternal mortality. You and I are aware of when the government came up with a policy of making cesarean section, that is operating those who are in their need of operation at pregnant women. So the government made sort of subsidy on it so that they can have easy access to cesarean section. Then of course there is an improvement in drug availability for those who are living with HIV. The government has put some money on that, and there is issue of infrastructural development across the country, and some other things. But of course, Nigeria is a very large, and because of the very low investment in health over the years, like in 2020, in 2000, sorry, there was a meeting of all the ministers in the Africa region that health will need to be up to 15% of the budget, especially at the central level. Nigeria has not been able to make up to the 15%, but over the years, especially with this new administration on board, I think there is an improvement. But certainly, it's like a little drop in the ocean. There's still a lot to be done, especially in the area of public health and infection prevention. Like my chairman has said, we need to invest in surveillance. That's what we call surveillance, which is to detect disease before there is an outbreak. So that's because if diseases are detected very early before an outbreak is occur, then it's much easier for such disease to curtail the morbidity and mortality that will follow. Then in the area of infection prevention, area of non-communicable diseases, there's still a lot to be done, especially in our hospitals where most of our community members do not present to their doctors until they've gone around, spend their money and all that. So those are areas that still has a lot of impact on the spending. So health subsidy is one very area that need to be paid attention on. And I know recently the government also come up with subsidizing some
dialysis.
Yes, dialysis. We all know that hypertension and diabetes are one of the non-communicable diseases that that is killing our population. The number of our community of the people who goes for dialysis these days is becoming really very scary. And I know this week the nephrologists are having their week. That's to call attention on the number of people who go down with renal failure. So the government coming up with subsidizing dialysis to the extent of cutting it as low as more than 80%, I think is another way. But of course, we need to screen, and this is where the public health physician comes in. So before somebody goes into renal failure, end stage renal failure, and then we need dialysis, we need to detect early, ensure that the renal function tests are done, they are clinically assessed and they are detected early. And one of those things which is responsible for failure of the kidney is a very high blood pressure. If blood pressure is not detected early, it could be a big problem. And this is simple. It's just a question of walking into the hospital, get your blood pressure checked, and if there's any family history, that can be detected early, and prevention situation can be put in place. This is where public health comes in as well. And not just that, we can screen outreaches and all that which we do, and on a constant, regular basis. So we still have a lot, and it revolves around providing funding for some of this. And we all know what is happening at the global stage now, where funding for some of our corporate entities is being cut, and so that means that the government, both at the central, the states and the local, need to come in and ensure that health is well funded and the right people and the right place. And of course, the human resources for health. The government need to take drastic measure in order to cut the people leaving the country. As much as we train, Nigeria have enough schools and tertiary institutions that train, but we shouldn't allow resources that have been invested in our people to now go into other places. So we need to cut down on people who are going out. And like my chairman has said, the only way is to ensure that, you know, people enjoy the effort they've put into training. By the time they start working, you should be able to at least ensure that your family too can be satisfied, and then you provide what is needed to be done. So if people need to go out in order to ensure that's not good enough. So health workers, doctors, and other health, you know, workers need to be you know, the government need to ensure that they have enough living and then satisfied with the job that they are doing. Thank you.
Okay, Dr. Ahmed, you talked about the non-communicable diseases, of course hypertension and of course diabetes, part of them. You saw the rate in 2024, for instance. The different statistics was speaking largely about how you've also alluded to that reality, that the numbers are really going higher. And some would say that apart from giving medications, apart from how can we prevent it? And they say, oh, we're talking about an economy. The economy is giving people that kind of, you know, especially the high blood pressure part of it. And of course, you hear people cannot feed their families. What can be done apart from giving prescriptions as to how the public can manage that aspect of their life?
Thank you. So the non-communicable diseases, these are, like you mentioned, diabetes, hypertension, even cancers and all that. And most of them, we used to classify them as some of the risk factors is modifiable and the non-modifiable. Non-modifiable are those ones that has to do with, you know, genetics, where you're from, and whether you're a male or female, or does it go in the, is it something that is passed on among the family members? And the modifiable one, which are something that's within the control of individual, lifestyle. Lifestyle is very important. What you eat, the way you live your life, and all that. Do you rest enough? Do you have time to check in the hospital how your body system is? Do you sleep enough? Do you take enough rest? We know if, in spite of the economy, if we are aware of some of these things, you can control them within your own, especially food and what you take. We know some people, what they take are junks, and these are the food that has cholesterol and, you know, high salt and all that, which are very important. So in terms of control, what we're doing now, especially the media, all that, they have a role to play in order to ensure the communities are aware of some of these risks. So we should commend you, because by, you know, educating the community, they know some of these things that they need to not to do, like salt need to be reduced, too much sugar should be curtailed, because once you pass the age of 40 and you keep taking refined sugar, it's a call to developing some of these chronic diseases. Then apart from that, we talk about screening. Screening is very important. We need to, if there is a family history of maybe a breast cancer, hypertension, or diabetes, that individual needs to start going to the hospital for checkup, and that can save a lot of problem, because what you spend like 1,000 or 2 in checking, you know, and you didn't do that at the right time, it might be a reason to spend 50 or even more than that 1,000 of naira in order to treat. And we all know what the cost of drugs are now. So before, if it now gets to treatment, maybe now come down with complication, then that is where the big problem now comes in, because you now be managing the complication of such diseases and all that. So the message is this, that our people should know that visiting the hospital, even when you're not sick, is most important than when you're already sick. Because when you're not sick, you'll be able to learn one or two important information in order for you not to get sick. And of course, the economic situation will not be adding to the problem. Because like I said, you go to the hospital, you are checked, and you are told that, look, you need to do this, you need to do that. But when you're already sick, it might be an emergency situation that you're not being admitted to. And then, you need to do a lot of investigation and then a drug, which are very important. So awareness is very important.
Okay, Dr. Adesanya, it's important we also talk about poverty, which is one of the things that people would say is making the whole situation look very terrible at the end of the day. What role, people talk about family planning as a key aspect of public health concerns as well, that if you're not able to manage the population well, at the end of the day, the poor people with 5-10 children would definitely create an environment where where diseases can actually get to them. So how do we address that?
Yes, you are very correct. It's a known fact that poverty brings ignorance. And of course, when that happens, a disease comes in. It's a vicious cycle. Poverty leads to ignorance, ignorance to disease, disease to poverty, and all the like. And let me quickly explain that when you are sick, you are going to spend money on it. You are not going to earn money. Somebody is going to care for you, and the person caring for you will also need to spend some money, and that person too cannot earn money at that time. So it's a big thing. So it's very, very profitable when you don't fall in. And just like my colleague said, it makes more sense when you look after yourself without falling ill. Poverty and ignorance are major social factors as far as disease is concerned. When you are educated to some extent, you have access to information. When you have access to information, you know what to run away from, you know what to wait for, and you know what to take, you know what not to take. And one of the issues that complicate the socioeconomic well-being of individual is what you just talked about, and that has to do with our family. In the olden days, when a man marries a wife, the wife serves the man, and when they have children, the children will help in the farm. So at a certain age, the man can bring in a second wife, and at a certain age, a third wife, and the number of children keeps increasing. The person with a large family then is a rich man, because he has a lot of people to work for him in the farm. Now the question is, how many children work for the father or for the mother this time around? So it makes no sense increasing the family size. It puts a lot of burden on the resources. If you are earning 100,000 in a month and I'm also earning 100,000, if my family size is 5 and yours is like 10, then I'll be much richer, I'll be much better, because a lot of resources will be freed for me to use. I will have more to be able to care for my family. I will have more to be able to provide for them in terms of food and all the like, shelter and everything. So keeping a sizable family is usually very, very fine, very profitable. In terms of economy, I mean, you cannot measure the economic gain from that. And in terms of health too, because the health of the mother, the health of the babies, and even the health of the father, the health of the community will all be improved if we don't have exponential increase in the population.
Also, Dr. Adesanya, let's talk about the international aid that we hear that was cut. And we know that the majority of our interventions, health care interventions in Nigeria, depend largely on these funds that are coming in from the international bodies. So how do we now fare when these monies, when these funds are not really coming in again? How do we improve the public health system that we think is not even doing well at this moment? When this one are no more, how do we then move ahead and improve on it?
Yeah, thank you very much. That's a very interesting question. There's one thing there. It is very glaring that we are going to be affected. But I strongly believe that it's going to be for a short period of time. Because as I said when I was responding to one of your questions, our government now is a responsive one, both at the federal and state level. It's a simple, let me give you this scenario. If you have a baby and you are used to feeding your baby, the baby is not likely to want to feed himself because he enjoys the food as you put in the mouth of the baby. But then as a mother, you want the baby to learn to feed himself. So that is the situation now. Now that it's not coming, it's a simple matter we learn to try and manage our situation. It is correct that the population of Nigeria is not really allowing efforts to be fully revealed and seen as early as possible. But the point is, we will learn now to manage the situation in such a way that we will cope. It's not that our government has not been doing anything all along, but just because the aids are coming, we don't really learn to cut our coat according to available cloth. Now we were cutting according to our size before. Now we need to cut according to the cloth that is available. That's just what we need to do. I am so confident that we are not going to run into any big issue in Nigeria because of the stopping of the AIDS.
Dr. Ahmed, let's talk about the environmental health concerns. In some parts of Nigeria, we know that living in those areas will bring in public health concerns. There's no two ways about it. For instance, those oil producing states or those areas that the blasting and environmental noise are, you will come down at one point or the other with environmental health concerns. So how do we tackle this concern and improve on our public health? And how can these environmental concerns be minimized? We know that in some areas it cannot be taken away totally. How can it be minimized looking at our public health?
Thank you so much. We know that climate change is an issue which is in the front burner of global issue. Those things that you mentioned, like burning of fossil fuel, environmental degradation, and even falling of trees and all that contributes toward the climate change. And it's not just at the federal level or the local level, even at the international level. We know there is a body that takes care of the climate change issue. It's not just that. Even waste disposal. For some of us who have been to cities, especially I want to use Lagos for instance. Once you enter, you see heap of waste and where it's been burned. The technology and innovation has moved from there, and I know some states have also adopted more innovation in order to ensure that we don't continue to burn refuse and allow the environment to be clouded with smoke and all that, which eventually increases the heating up of the hearts and the community. So environmental health is very important, and it also has to do with disease prevention. When you allow waste and refuse to be dumped openly, you allow other mammals like rats and all that, and that is why, which I mentioned in one of previously, that Lassa fever continued to be a problem, because the mouse they feed on those things and then come back to the house and again and infects the people. It's not just that. Even pollution, air pollution and all that. They also had to all the problem of respiratory tract infection and all that. So the Ministry of Environment and the Ministry of Health, there's always that collaboration, and there is this strategy that they call the One Health, the One Health strategy, which is one of the topic we'll also be taking, in our conference today. So One Health is important because you cannot remove the environment from human and then disease prevention within that cycle. So is one single program that can ensure that the health of our people and the community is taken care of. Even the noise pollution and all that, these are some of the policies that the government need to put in place in order to ensure that the noise, especially in area where there are industries and all that, yes, is being controlled. So we move now to the south of the country where there is exploration and all that. We know that there is the government is also trying in order to reduce all these illegal bunkering and all that, which made the environment to be polluted, and then which eventually affects the people. So all we need to do is to continue to urge the government in order to improve surveillance of some of this, ensure that the security people, they ensure that those who are practicing all these illegal practices are apprehended, and the right agencies take care of it. But I know within the health access, it's the responsibility is for each and every one of us to be aware of some of the implications of this environmental pollution. And within our own confine of our home, we ensure that our environment is clean. We dispose our waste where the government has set aside that waste will be done. And then for the government at all the level to ensure that there is an holistic approach to waste management, so that the burning of waste is none of it anymore, and because it's further hard to eaten up the environment and all that. So it's a whole lot of program that all agencies of the government need to come together and work as one. Thank you.
Okay, Dr. Adesanya, let's look at how to solve some of these problems. We say that the primary health care center is largely the closest to the people, and the state is critical to whether they will address the challenges of the people. How can we know that Ogun State government, for instance, has done a lot of renovation and of course, put in place, equipment in some of them and all of those things. So how well is that serving the people as we speak, and how much more investment do you think we should do?
Thank you very much. Primary care is ideally, under the conditions, should be affordable and should be accessible. It should be readily available, and that is where we have holistic care, we have essential care being delivered to our people. Under the condition, somebody doesn't need to go more than 5 kilometers within is confined in his area before accessing a primary center. And I can authoritatively tell you that governments at all levels have been trying a lot in improving primary health care in Nigeria. That one is very, very certain. Of course, specifically in our environment in Ogun State, there has been an improvement, especially the present government. A lot of renovation activities, a lot of supply of equipment and all the like. But something must be mentioned. Primary care is not solely a responsibility of government. I think we need to let people know about that. It is the first level of contact of all individuals with the national health system. And so we need people to take ownership of their health, especially the PSC. At the beginning, we were talking about community involvement. Later, we talk about we were talking about community participation, community involvement. Now we are talking about community ownership. We should take ownership of it. Let me give you an example. If an immunization program is going to happen in your area, in your village, and the immunization officer comes and needs to keep its vaccines for 2-3 days, there's nothing wrong in you providing your refrigerator for them to be able to keep the vaccine instead of having to go back to the center each and every day. That will reduce a lot of cost, and that is a contribution from your side. Almost every home will have a refrigerator. I'm just giving that as an example. We want to go to one village to go and see people over there. There's nothing wrong in motorcycles outstation, making 2-3 motorcycles ready, available for them to be able to move, instead of asking the governor to come and buy motorcycle for them for the purpose of the immunization campaign and the like. So, what I'm trying to say is that every individual needs to get involved. In fact, we can have people coming to render services as a matter of contribution. In my village in December, I got there and I discovered that somebody came and they brought in some drugs and they said, okay, let's screen people for some diseases. So these are contributions that all of us need to make. But by and large, primary health care needs to be strengthened, because that is the level at which we render holistic care.
Apart from the myths that you encounter on the field, some people saying they cannot trust the doctors, they cannot go to the health center, they believe in their traditional way of taking care of themselves. What role do traditional and alternative medicine play in Nigeria's public health system?
Anyway, let me quickly mention that primary health care is even, the reason why I say acceptability is that it accepts your culture. It allows you to be able to practice within the level of your culture. But the traditional birth attendants, the community birth attendants and all the like, they are also accommodated under the primary care system. The thing there is that if you send them away and say they are not trained, they are not to be used, people will still patronize them. So what we do in PSC now is to bring them to us, and we get some trained officers to look after them. Okay, we even have some that are a little bit below them. We call them voluntary health workers. Okay, that in your area you want to volunteer, that you also want to assist. So now what we do is we train them, especially on safety measures, on aseptic techniques, and all the like. But then we now give them limits. For instance, you are not allowed to give injection. You are not allowed to. But the major problem in the environment is that majority of our people, not only TBS, majority of our people want to practice beyond their limits. And there's where the language quackery comes in. Because when you now have a TBA attempting to do suturing, that one is quackery. But in environments where people patronize them, we also arrange for community extension workers, junior and senior, to look after them, get a quote, and then it's okay, look after these people, get their reports, and then we also connect them with health facilities, so that we let them know that if you have something you cannot handle, don't fear and don't fear somebody's going to arrest you, so you can quickly refer to this place. That helps in reducing mortality.
Before I allow my colleague, let me take this. The employment of public health doctors, that's the fellows that we got to hear in the course of the last week, to be precise, where the president said they have been hired, 774 of them from all local government. I don't know if you have any update on that, whether after that, what are the things that the people should expect them to do?
Okay.
Doctor.
Okay. Let me take that.
Ahmed.
I think is a good development, and is a recent one. They call them the health. Is it fellows?
Fellows.
Yes, health fellows. Yes. Yeah. So we still need more, but is a token, and the health community wants the present administration to do more. Well, of course, by the time those people get to the community, I believe they were selected based on their qualification and ability to provide the quality service that is expected of them. So if it's done, by the time they are able to get to the community where they all come from, they'll be able to garner the support of other medical and paramedical services, and it is expected that the health of the community will improve. The first thing to expect of them is to create that awareness, because it's a new government policy, and the community at the grassroots may not have immediate impacts of some of what they were, but they will have their what they need to do, their activities they need to conduct within their local government. So, and of course we have an already established practices and institutions within the local government. So by the time they come back to the local government, they should be able to coordinate activities around service provision and institutional development. So it's expected within the framework of maybe a year or so, they are now being appraised. We should expect that there should be an improvement, because they are from the community that is close to the people, which is the local government. And then they will be able to know what are the challenges the community is facing and what are the health problems that they are facing, and be able to ensure that both the community, the local government, the state and the federal, they're able to focus and prioritize the health issue. This is just coming up. They're just being recruited just recently. So until they start working. But Nigeria is never lack in policies and programs. It's implementation that is the problem. So now that the government is coning down to the community, now we'll be able to get the feel from those people who are supposed to enjoy those healthcare delivery. And I believe they will do well.
Okay, now let's go to the health equipment and technology that we use now in providing the service for the people that comes for it. Do you think we are on the standard level of using this technological advancement in administering healthcare to the people? And if we are not, what do you suggest that we do now to be at par with the global standard of using the technological innovations? We are in the era of AI. When are we going to get to that level, Dr. Ahmed?
Okay, well, in terms of infrastructural development and innovations, I belong to the MD-CAN. Let me speak for my community, the immediate community, which is the Federal Medical Center, Abeokuta here. I know recently the hospital has been able to have an approval of high-tech diagnostic equipment within the hospital, which will improve and ensure that there is early diagnosis and improvements in the delivery of these services, especially things that have to do with radio diagnostic equipment. And I also know that some of my colleagues who specialize in some of these areas, they've been even out of Nigeria to train. So those who are trained and they are back in the country, they'll be able to provide further training and retraining of the lower cadre. So these are some of the things that we expect from the government, and we want to ensure that it's improved. So talking about AI, artificial intelligence is a new talk in terms of even not just the health, even in education and all that. And it's the impact is to improve the diagnostic. Instead of doing it manually, it can improve it, improve in time, improve in access and all that. But what I see as a challenge is infrastructure. we all know what happened just some few months back, where one of our, facility or health institution was going through a problem of lightning. So, and this is what most tertiary institutions are also facing. Even the local, there are times that there are no infrastructure. So the government needs to improve on the infrastructure and then training, so that when investment is made in infrastructural development, the people can enjoy it. Thank you.
Dr. Adesanya, we have just 2 minutes before we leave the program. Let's talk about the misinformation that people have about public health. Can you tell them that they shouldn't think about public health and what they should think about public health?
Oh, that's interesting. That's interesting. Public health is a specialty of medicine that I just believe should be coordinated by public health physicians, but all of us should be involved. You are also playing a role in public health. You are also adding to it, because what we are doing now is what we call education. We're educating the public and you are participating in it. So everyone needs to be involved in public health. That is one. Two, public health believes in clients and not patients. We don't want you to fall ill. We will see you as healthy and we want to come to you. It is a bridge between the hospital and the home. And we want to be your friend. See us as doctor friend, okay, in your place. Then three, we also want to encourage everybody to have very fine environment, eat well, know what to do, know what not to do. Then there are some things we call specific protection. Diseases that we feel that are really dangerous in your environment, you must protect yourselves against that. For instance, you work in an area where there is radiation, get yourself well protected so that you will not fall into some areas. Then public health misconception is that we are concerned with communicable disease only. That's not correct. That's not correct. In fact, there are many non-communicable diseases where infections are even risk factors. So,
all right.
Yes, I want to say thank you very much.
Speaking with Dr. Adewale Adesanya, the Chairman, Association of Public Health of Nigeria, Ogun State Branch, and we've also been, getting insight from Dr. Kayode Ahmed, consultant, Public Health Association, Epidemiology. Thank you so much for being our guest on the program today.
Thank you.
Thank you for coming.
Yes, New Dawn continues on Friday. Otuoja will be for tomorrow. Thank you so much for being a part of the program. From here, we'll say bye.